Welcome to the Masterclass series, Being Future Ready, brought to you by the Vadhwani Institute of Technology and Policy and the Indian Institute of Management, Bangalore. We are excited to bring forth leaders, academicians, policymakers, thinkers, strategists, and experts on emerging technologies where they will share their experience, expertise, and advice on digital transformation and the adoption of implementing emerging technologies in the government that results in stronger governance and better public service delivery. In this masterclass, we will have the following agenda for you. We would like to introduce ourselves. We are Vadhwani Institute of Technology and Policy from Vadhwani Foundation. One of the key benefits of the Masterclass series, Being Future Ready, is to meet and interact with industry experts, accomplished government leaders, academicians, and practitioners on emerging technologies and digital transformation. We learn in these sessions their experience, expertise, and advice on digital transformation and the adoption of implementing emerging technologies in the government that results in stronger governance and better public service delivery. To make this experience worthwhile, we will also be awarding a certificate of participation to all registered audience members who attend at least 50% of these masterclass sessions by IIMB and Vadhwani Foundation. So without much further ado, let's dive into our masterclass session today.
Namaskar and welcome to the masterclass series of Being Future Ready. My name is Purabhi Mitra, your host for today, and we welcome you to the 12th episode of the masterclass series on Being Future Ready. Before we begin, I welcome wholeheartedly our guest for today, Shri Jai Satyanarayana ji. Before I introduce him, I'd like to quickly share that this masterclass is where we are going to hear a talk from our esteemed guest on the topic of being future ready for the future of healthcare. For those of us who have attended these masterclass sessions before, you'll be aware that we will hear the talk first in the first half, and we urge all our listeners and viewers to please write your questions in the chat section so that we can moderate them in the second half, and we will select pertinent questions that will be moderated in the second half. We also would like to take a moment to introduce our partners. So we have IIM Bangalore here. So I'll request Venkatesh to come and briefly introduce IIM Bangalore to all of us. Venkatesh.
Thank you, Purabhi. On behalf of Center for Software and IT Management of IIM Bangalore, I take pleasure in welcoming the speaker for today's event, Sri Satyanarayana ji, Prakash ji, Purabhi, and the entire of Vadhwani team, Rajnish ji, Puneet, and the entire of Digital India team, and all the participants for today's event. Some of the key points worth mentioning about CSITMR, this was started way back in 1998, and Professor Shankadeep Banerjee is the current chair. And over time, it has been serving as a hub for open exchange of information among academia, government, and industry. And it has a huge global network of resources. And the mandate is to support research and training activities through seminars, workshops on contemporary topics which involve artificial intelligence, digital transformation, product management, digital government policies, and so on and so forth. So from that angle, the Masterclass series is of very big importance to us because it brings together academia, government, and industry. And we conduct varied events, webinars and seminars, and some of them are large residential programs. And we welcome you all to sign up and attend the events that are scheduled for the rest of the year and going forward. We have at least 3 events coming in December. And one of the events worth mentioning is the Software Product Management Summit, which we have scheduled for the early part of 2024, 15th to 17th February 2024. And the call for papers and the nomination for Excellence Awards are already issued, and you may have received communication related to them. And we find that most of you are in some way or the other related to software products, either in the capacity of developing products or managing projects that involve software products. So please do nominate your products or participate as paper presenters. And looking forward to your participation. And with that said, I welcome you all once again and hand it back to Puravi.
Thank you very much, Venkatesh. I'd like to also invite our other partner from NEGT. We have Sri Rajneesh Kumarji, who's the COO and Director at National E-Governance Division from METI. Sir, would you like to please say a few words before we start?
Thank you, Purvi, and welcome, Satyanarayana sir. I've been in touch with you for the past 3-4 years when we were doing NTR at Education Ministry, and it will be a pleasure listening to you, sir. Welcome on board, and from behalf of NEGT and DIC, we welcome you, sir. Thank you.
Thank you, Rajneeshji. Also from Vadhvani Foundation, we also have our CEO for Vadhvani Government Digital Technology, Sri Prakash Kumar. Sir, would you like to say a few words before we start?
Thank you, Purvi. I take this opportunity to welcome Sri J. Satyanarayana sir to this master class series. This is the 12th episode, and we have had many eminent speakers like him before. And this we bring here in partnership with IIM Bangalore and NEGT. The idea here is to bring people who have achieved great heights in this particular area, that is digital transformation. And we cover different aspects. And today, Sri J. Satyanarayana sir is going to talk about healthcare and future of healthcare, how technology is going to impact and what kind of role technology is going to play in this arena. So with these few words, once again, I welcome Sri Satyanarayana, and over to you, Purvi.
Thank you, sir. Without much further ado, I won't take too much time. I'm very pleased to introduce our speaker, Mr. J. Satyanarayana ji, who's also the Chief Advisor at CARE India at the World Economic Forum. Sri Satyanarayana ji has been a member of the Indian Administrative Services for 37 years. He's held several positions in the IT and related areas, including being the Secretary at the Government of India, Department of Electronics and IT, and the Chairman at a part-time role at Unique Identification Authority of India, Aadhaar. He is a pioneer in the design and implementation of e-government programs and projects in India. He has been associated with over 20 major e-government projects at the state and national levels, which include eSeva, Passport Seva, MCA 21, Bangalore 1, AP Online, and ETAL, to name a few. He has been instrumental in the design of several policies in the ICT sector at the national level in India, including the policies on cybersecurity and on adoption of cloud technologies called Meghraj. Sri Satyanarayana ji's recent contributions have been around enterprise architecture and ecosystem architecture. These include India EA, which is India Enterprise Architecture, Agile, India EA, National Digital Health Blueprint, known as NDHB, and National Digital Education Architecture, known as NDIA. He has been advising for the Center for the Fourth Industrial Revolution India at the World Economic Forum since 2020 on projects concerned with responsible deployment of emerging technologies in the sector of agriculture, health, and education. He has advised the World Health Organization, the Southeast Asia Regional Office, during, or rather from February to September 2023, on the implementation of the digital health programs in the member states. He's also published 2 books, one being E-Government, The Science of the Possible in 2003, and the other being Managing Transformation, Objectives to Outcomes in 2012. Please, let's welcome our speaker for the 12th episode of the Being Future Ready episode of Masterclass series, Mr. J. Satyanarayana ji. Welcome, sir. Over to you.
Thank you, Purabhi, and it's a great pleasure to be talking to a group of eminent people and also the other panelists who spoke before me, and to share some of my experience in the particular topic of healthcare. So while the series is about future, but we possibly cannot talk about future without knowing what is the present. So I have divided the presentation in two parts. The part A being about the present and what's currently going on, and part B will be a little bit about future and the emerging technologies which have a great role to play in future. So we'll have a short break of 5 minutes after part A so that we can have some discussion on that and then go on to part B. So most of what I'm going to say is arising out of my personal experience and having worked in IT and healthcare and other sectors. So with that, I go forward. So just setting the context for this session, we have so many organizations, and including governments and global organizations working on health matters. But at the end of the day, there is much to be desired. UHC, which is a universal health coverage, is a very nice dream that everyone should have the minimum, access to minimum set of health services globally. Nobody should be left behind, which is that we should reach 100% ideally, but currently we are at 58% globally. So which means that we are just crossed the halfway mark. And very disturbing fact is, in this 21st century, we have still mothers and infants dying during the birth process, and mortalities are pretty high, as I will show a little later, and anemia in women and children, showing that nutrition is also a very big problem globally. One more phenomena is the rapid increase in the non-communicable diseases globally, like the diabetes and cardiovascular diseases, cancer being the top 3 in the chart. So the number is increasing because the lifestyles are changing and the food habits, etc., are changing. Pollution is increasing, and as a result, these non-communicable diseases are on the increase. And then very significant fact is out-of-pocket expenditure on health, from especially among the underprivileged, poor, economically poorer sections, is pretty high. More than 50% of their annual income goes into healthcare. So in most countries, and at the end of the day, globally we are spending in excess of $12 trillion on healthcare. Despite that huge expenditure, it's more than the economy of two big countries like India and China. So that is the situation today. It's not a very happy situation, I would say. And some more facts and figures here, just to reiterate what I said in terms of more numbers here. One is there is a huge shortage of health workers, be it the health professionals or the frontline health workers. And also there are a lot of inefficiencies in the system, and globally you can see that 10 million or 1 crore health workers are in short supply globally. That means the doctor population ratio is adverse, and the nurse population ratio is also not to the norm. Then when you come to the outcomes, we have overweight, obesity, diabetes, and cancer, as I mentioned before. And then last one is the access. The UHC perspective is that half of the world, close to half the world doesn't have access to good healthcare. So these are the global challenges. You can see some more numbers here, just to bring home the fact, which is glaring at us, that the mothers and children die. And you see the disparity in African countries, and it's pretty high compared to some of the better placed regions in this world. So global average itself is quite away from the targets that we have set ourselves for 211 being the in 2017 for MMR, and IMR is also 36.6. So this is one thing. And look at this picture, which shows the catastrophic health spending. This is of course not the latest figure, but there is no significant difference even today, that almost 1 billion people, they are incurring catastrophic health spending. While the ideal should be 10%, we are in excess of 50%, as I mentioned before. So this is a very disconcerting or very unpleasant situation to be in. Now against this, let us see what we can do to address these global challenges. It's not India alone, it's not developed countries alone, all over the world. These problems do exist, and how do we address them? As I said, part A is about using the conventional, I'm saying, digital technology is become a little dated, and we call it conventional at this point. And emerging technologies are the future. So part B will address that. Now, talking about the digital technologies, what is it? Before we talk about the technology, we should understand clearly what is it that we want to achieve using that technology. While health sector is extremely large and complex, two things, big objectives we can have in front of us. One is the universal health coverage, and the second is the Sustainable Development Goals, or SDGs as they call. SDG 3 especially talks of healthy lives for all and promote well-being for all at all ages. So it's a pretty big desire and ambition. So while it has several indicators, including the ones that I mentioned, the maternal mortality, infant mortality, immunization, etc. So we need to factor these two in whatever we're doing, whatever digital tools we're employing. Is it going to improve my UHC coverage? Is it going to move me faster towards Sustainable Development Goal 3? So that's why I just mentioned it as a beginning slide here. Now, more granularly, if you look at health systems, which are a set of organizations, people, and actions whose primary intent is to promote, restore, or maintain health. They're all health related, wherever they are in the supply chain or the value chain of healthcare. So there are several problems. Without problems, I know we would not have had such a unpleasant situation or uncomfortable situation as I have been describing the last few minutes. So what are those granular problems we're trying to, because unless you know the problem in granularity, you can't address it properly. So in the next few slides, 4 slides, I have tried to describe some of those problems. We all know these problems, but I have structured them in a way that is addressable to technology. So the first slide here out of 4, it looks at it from 4 perspectives. So the patient perspective, what is it that the patient, what are the pain points of the patient? The first one being access to health services in different ways, whether it is due to geography, due to lack of awareness, due to lack of outreach by our own frontline workers, etc. Second is having got to a service point, a touch point, the experience is poor and the quality of service is not to the expectation of the patient, or the patient doesn't, the outcome is not, is not getting cured despite several visits. Then non-availability of medicines is one more problem in time. Then out-of-pocket expenditure, I have already talked about it twice. Then having gone to a facility, very often, there are a lot of delays, long queues, and uncertainty of how long should I wait before I get to see the doctor. So these are some of the problems that people patients have. So out of this, you can see I have marked some of them as green, meaning that they are addressable through using this. Not that, digital technologies can address every problem. If I'm short of beds in a hospital, how can putting a computer there, increase the bed strength? No. So obviously, not everything can be addressed by digital. And as you see, 7 out of these 15 pain areas can be possibly addressed by the digital. Likewise, if you see the doctor perspective, the high turnover of patients, there's a tremendous amount of pressure at the doorstep of the doctor, consulting room of the doctor. So with the result that the doctor gets to spend less than a minute for an OP patient and then write something on a slip of paper and give it. And as a result, there is very poor documentation because you're continuously like a flow. And in some hospitals I have seen, not only in India but abroad where I have been consulting, that the patient doesn't get to sit on a stool or chair, and then he's standing and the doctor is forced to talk to him, say a few questions, ask a few questions, and then write out the prescription. So this is the kind of pressure that we are going through, and inadequate support systems, system inefficiencies, and lack of competencies. There is knowledge gap also, because very often the expert doctors, they would prefer to stay in fairly urban areas, and rural areas there is hardly, not that kind of expertise available where most of the population lives. Then, and low motivation of the doctors and frontline workers also. Here again, 8 out of 15 can be impacted positively using the digital. The third is from provider perspective, again the same old story, the heavy pressure, shortage of resources, planning and coordination, reporting, all those administrative burdens are there, a lot of paperwork, and managing logistics. And lastly, the government itself is under great pressure. It has its own challenges in dealing with healthcare. So, which is a summation of the problems that others, of course, comes to the government end of the day. The buck stops here, as we say. So, typically in this, I would like to pick up the siloed approach that the data or information generated in one place is not able to be, communicated. There are 100 standalone systems which don't talk to each other. So there's a very big problem. You have put computers all right, but they don't talk to each other. And obviously, the benefit would be suboptimal. And then the MAS is not real-time or up-to-date or accurate, complete, and other problems. So some of these are directly addressable again by using a digital health systematically. Just dumping computers is not a solution there. You need to place them, position them in the right place, in the right way, subject to a right architecture. So that makes, the best out of digital. So these, having gone through these problems, and now I'm just getting into the digital health aspect, what's happening in addressing these currently. So just for a general understanding, digital health is a systematic application of ICTs, computer science and data, so that the decision taking is very correct. Correct decisions get taken by individuals, by the professionals, and the frontline workers as well. And also to overall reduce the burden of disease and be resilient to the disease is the. So the key thing I would like to message on this slide, I would like to say is that digital health is not about digital, but about health. While digital will help, but the entire workforce should have the motivation to leverage that and focus it on the health aspects rather than the digital aspects. Otherwise, you get lost in technology and other nods. So this is the digital health concept which has been there almost for 2 decades now. And more specifically, what it is trying to do, that the availability, efficiency, quality and accessibility of services should be improved end of the day. With or without computer, they are required. When you put digital, then it should be interoperable. Then you should be able to reach out to people in the remote areas, open standards, personal health records, which is a very important. It's a consent-based. The record is not, or it is not owned by the institution or hospital that I'm visiting. It's my record, my health record. So I should be in control of that, just as I'm in control of my email, my WhatsApp chat, etc. It should be as similar to these things, that a person is in charge and control of his or her own. This is a very tough thing to do, but very, very much required going forward. Then the portability and cross-border exchange of health data, and the whole sector should be governed more effectively as a result. So all this can be achieved if you have a game plan, if you have an architecture, if you have a right approach, right strategy, as you will see going forward. Then what are the things that we can change? I'm saying first thing, that you see in a hospital is long queues, and already people who are suffering with disease, they are standing in line or squatting somewhere, or even lying down on the floor because they are too weak, to even sit or stand. So how do you eliminate this? How do you go from a situation of queue to QR? We have seen this happen in several sectors, right? So I am epitomizing or, summarizing the whole essence of that suffering. How can you eliminating the suffering of people in queue? We have done several initiatives in different form, right from e-Seva 20 years ago, 25 years ago, where we tried to abolish the queues. And so today you have, for instance, Digi Yatra. You don't have to stand in line at all. Just use the QR and then you are just like a green channel, you can walk in. So can we have similar situation in the hospitals, which is really need of the hour? Then continuum of care is another opportunity that we have today. So to enhance the patient experience, irrespective of where a patient is going, the record is interoperable. I don't have to carry a bunch of files or individual records, and even if I am an educated person, I don't keep them properly. You think of an uneducated or other rural person, the records may be not really in order, and so on. So can we make it again seamless, paperless, as far as the health records are concerned, and make them all digital? Telemedicine, so that you have the benefit of, given that kind of urban-rural, divide that we have in terms of the availability of expertise, can we bridge that gap to telemedicine, so that, even people in remote area have the advice or the best expert who lives in the town. And then once only principle, the system, especially health system, everywhere you go, unless you have, gone to the same hospital twice, you need to repeat the whole story again and repeat some of the tests also, which is quite unproductive and waste of time and effort and resources. Then at the end of the day, reduce the cost to government and citizens through interoperability and PHR. So once you increase the efficiency and remove the inefficiencies and wastages, obviously you are saving a lot. And once you are also detecting a disease early, then obviously the burden of disease down the line is getting reduced. So that is one thing. And also, last but not least, is prevention is better than cure, and wellness is better than healthcare. So can we move to a situation where people are conscious of their own, how to improve their, look at it from wellness point of view. I may not have any problem right now, but I live in a way that I don't hit into a health problem soon. So the wellness thinking is also very important, which you can use digital means to improve that. So now that, having said that, you need to, these are all very good things to have, but do I do them one at a time, or do I plan for all this entire wish list? Do I create a nice integrated way of looking at this wish list, right? So that it's all cogent and coherent and consistent and simple. So that is the idea with which we went to. We did this concept of digital health blueprint, so that it's a time-bound action plan which is costed, which is really you may have a strategy which is at a 30,000 feet level, whereas a blueprint is somewhere around 2,000 to 3,000 feet. When the plane is about to land, that kind of a view you will have in a blueprint, so that you are very clear as to what I want to do and how I want to do, and what is the architecture which makes this happen. So it's also called digital health enterprise architecture globally. So this is what we have done in India in 2018, and several other countries are following suit now. So what is it we are trying to do this, achieve through this blueprint? I have shown 4 slides of problems and some possible green areas where digital can intervene. So these are all the challenges. If you take the challenges as your starting point and then create a blueprint that addresses almost a majority of those problems, whatever can be done digitally, whatever can be improved digitally, then you have a set of nice holistic digital health services. So this is the digital health blueprint, is the very essential link in the whole thing. Without the blueprint, if you go on doing 20 different things in 20 different areas, so it's going to be a problem. That's why the blueprint is very important. And personally, I've been associated with, while there have been strategies which are at 30,000 feet, as I said earlier, in several countries, but putting it together in an actionable document, we did it in India for the first time here. You see on the left here, National Digital Health Blueprint. 2018 we prepared, 19 it was notified as the standard for the country. So I had the privilege of being the chairman of this expert committee. And then deriving from this experience for WHO, I have been associated, we have done for Maldives, it's in a draft stage at this point of time, and more recently in Bangladesh. Maldives is just 500,000 population and Bangladesh is 170 million population. So different countries have their own way, and the problems are, while they are the generic slides, 4 slides that I have shown could be same, but when your blueprint is done, it is totally, the priorities are different and so on. So this is what we have done, and this is how this slide is. I don't want to go into too much of detail, but to say that a blueprint is a holistic, it takes it thinks big. What is all that can be done, should be done. You can do it over a period of 3 years, 5 years, fine, but you should have the whole agenda in front of you. And the essence of this is that you are adopting an ecosystem approach. So you call it ecosystem architecture, meaning that it's not only for government. 70% of healthcare is in the private sector, so, and also NGO sector. It is also central government, state government, local governments have their own health approaches. So it should synergize across all these different kind of actors. So that's why it's an ecosystem and it is again primary, secondary, tertiary. So there are so many variations. You can't have one blueprint for each one of them. So an ecosystem approach addresses all these actors and dimensions at the same time, rather than doing it piecemeal and then it becomes a hodgepodge. So in essence, you see this picture here, the foundational, for want of place, I should have placed these orange ones below, but for want of space, I kept them on the right side. But they are foundational in terms of certain basic principles Then the infrastructure security, data protection, which is very, very important. Personal data cannot be compromised, come what may. So data protection standards, which are very important, so that the MRI done at one place is readable in the same way, though it is communicated digitally elsewhere. So those standards. Now coming to the main diagram here, which is, you can see in the core, in the middle, it's called the core building blocks. These are all building blocks, like Lego blocks. In a very simple term, when you give a set of 20, 30 Lego blocks to a child, the child will pick up, different Lego blocks and create, a building, a vehicle, or a train, or a plane, or whatever shape the child wants to create can be created out of those same very different blocks, Lego blocks. So these are all like Lego blocks. You can reuse them in different combinations. So that is the essence of building blocks. And the most important one which the government should drive is the one in the center, which is the core. That is a universal health ID, which we call ABHA in India, Ayushman Bharat Health Account, and also a health information exchange. This UHID enables unique identification across anywhere, across the entire ecosystem, public, private, center, state, or any corner of the country. Then around that, there are certain registries, there is some consent management which manages the privacy of individual data elements. Then other master data, etc. And around that, you have 4 spokes, as you can call, hub and spoke. You have certain systems which are trying to address the community health problems or public health problems, like non-communicable disease programs and, civil registration and vital statistics and nutrition, etc. Mother and child health, which I started with in the slide 1. On the right side, you have healthcare and wellness. These are individual oriented. On the left side is the community oriented programs. On the right side is my health. How is it? How do I manage my health? So all the things related to the personal health records, the queue management, so that I don't have to stand in the queue, I can take an e-appointment, etc. And then the e-prescriptions, which go to the pharmacy directly and so on. Call center, telemedicine. Then on the right bottom, you have the information, which is the key to the whole thing. How do you manage it more efficiently? And how do you use it for managerial decision making and monitoring through dashboards and analytics, etc. On the left is the how do you manage your own workforce. We are seriously short of both the doctors, specialists, and also the nurses and frontline workers. So how do you do more with less? How do you make them more efficient in their own work so that they are able to, though they are less in number as per norm, they are able to manage the healthcare more efficiently. So the entire health force related issue on the left. So around these 4 circles, the 4 nodes, you can really build a lot of useful digital services. So that's how the whole, because it's very important, I spent a couple of minutes, this is the essence of the digital health. And you can see the key features I mentioned here, though it's expansive thing, I can speak 3-4 hours on this at length, but I'm summarizing and going quick. So on the left, you see the core building blocks. What was there in the center here? I've just mentioned it in writing here. On the right side. On the left side, the key features are the federated architecture. In a country like India and several other countries, even if it is a small country, because there is public and private, etc. So you need to have a federated architecture, not a unified architecture, not a centralized architecture, which is going to fail. You need to have a federated architecture. So there is autonomy for the states and public and private, and they can all interoperate through the protocols. That is the way it is designed. Then person centricity, like people should be in control of their own record and share it with consent with whoever would like you go to another doctor, so you can share your record electronically, and that new second doctor can look at what the previous one has written. Then building block approach, which I explained, trust through a policy framework for data management. Today, fortunately, we have DPDP Act in August of this year, Parliament passed it, and it has to, of course, take ground level reality. It may take a few months more, but at least a good. At the time when we were designing the blueprint for India Ayushman Health Ayushman Bharat blueprint, we didn't have the benefit of DPDP Act. It was still in discussion. So we went ahead and created this health data management policy, which in essence contains all the principles that the DPDP Act now talks of. So we went ahead with this policy, and it really worked well. A dedicated institution like a digital health mission was established, and then key thing is we should not try to do everything as a government. We should not try to do everything ourselves. We should only be enabler, and most of the things to be built by the private sector. On the right are the core, what was in the center there, the core building blocks, the ABHA, unique health ID, health professional registry. We can locate who are all the doctors, and easy, the right person trying to treat me. I can identify. Then facilities are all registered. Unified health interface is the protocol that I spoke about, which enables interoperability. And end of the day, you have the personal health record. All my records chronologically and episode wise, they are all sequenced and available at one place. Just like you can compare it with your own email records. Once you have a PHR, it's like an email. All my emails are sequentially positioned when I open my email. So it's as simple as people using Google Pay, right? Today, even an illiterate person, everyone in this country uses Google Pay or Phone Pay very effortlessly. So PHR will be as simple as that if you implement it. Digital health services, I will not go into detail, but it only shows that all the challenges with which we started are getting addressed by crystallizing into a set of digital services, be it from a patient perspective or a service provider perspective or a government perspective. They're all addressed here. If you are taking care of these services, you work backwards and build the software and other things required for that, you are almost there. So several countries, I'm just giving a quick example. Canada has got what is called Canada Health Info Way, which is a way of organizing their personal health records there. And Australia has also got what is called My Health Record system. We studied all of these things while we were building the India system, the Ayushman Bharat digital mission. So in India itself, what is the current as of today picture is that we have created, with the help of this blueprint which is on the left, you can take a full copy of this by clicking here on this. 490 million, meaning 49 crores of health IDs, ABHA numbers have been created till this morning. And 325 million, people have put their health records online so far. These are the records. The number of people may be less. They may be about 100 million, but each adding 3-4 records. Then about in excess of 200,000 doctors and facilities are registered. And we also simultaneously in 2020, we established the sandbox, because a lot of new solutions, digital solutions are coming, and patients should be absolutely confident and they should trust that the solution will do them good. So we created the health sandbox side by side so that it does two things. One is it ensures that the solution, each solution which is registered here is verified by experts, and then clinically it is correct, it's doing the right thing, and it's not doing any harm to the patient, number one. Number two, from a technological perspective, the interfaces are in alignment with the UHIR, Ayushman Bharat standards. So these two things, and then it's certified. So far about 60 solutions have been certified in these 2-3 years. Then also, end of the day, security and privacy by design is at the heart of National Digital Health Mission. So having said that, I will stop here. So that's where we stand currently. We need to expand this on this ambition and really touch the people very extensively across the whole country, and realize those 25-30 services While some of them are done already in this diagram that I showed earlier, a good number still have to reach the ground level. So that's where we stand today. And I take let us spend a few minutes here before I go into the emerging technologies or exponential technologies. Quickly, let me zip through the second part of emerging technology. What is emerging technology at this point? At least 12 technologies have been identified as emerging technologies today. Some of them do call it also exponential technologies, because the rate of growth is really exponential. Rate of development of those technologies is exponential and not linear, non-linear expansion. So some examples include, our most prominent example is artificial intelligence today, because it's the most evolved and most tested also. And other things like blockchain technology, IoT, drones, bioengineering, etc. Several other, a bunch of about 12 technologies. In fact, World Economic Forum, the center I'm representing right now, the Center for Fourth Industrial Revolution, deals with these technologies. How do you use these emerging technologies for the help of the common man and the population? So having said that, let me put it in the context of healthcare and see what can happen. Now you can just see in the next slide, this is a recent paper published by the World Economic Forum. You can see it in their site, weforum.org. So after surveying almost 400 different technologies, different applications of AI in healthcare, they have distilled it to these areas which are really most usefully benefited by AI. So from a patient perspective, they are seen from three angles: patient perspective, the population perspective, this is individual health, this is population health, and this is the product, meaning medicines, etc. So from a patient perspective, it can be used to improve diagnosis, the quality and efficiency, accuracy of diagnosis. The treatment cycle itself can be improved, the adherence to medication can be improved, and people can be educated, health education can be improved. So these are four possibilities from using AI from a patient experience, patient's perspective. Second, from a population perspective, disease surveillance like COVID or any other communicable disease, how do you keep a tab on that and be ready to meet different kinds of diseases? Not only communicable, even non-communicable diseases can also be tracked using this. Then actual delivery, care delivery at the point of service. And then the logistics like medicines and other supplies, medical devices, etc. Then at product level, clinical trials can be speeded up. We have seen in COVID time, what used to take 5 to 6 years to clear a vaccine from a clinical trial perspective was done in about 12 to 15 months. It was in the market. So which is clearly because they have used a lot of AI models to fast track several processes. And similarly, drug research, discovery of new molecules, etc., and then logistics also. Then these are the areas that are there. Then I will quickly speak of two interventions that the forum has done from a World Economic Forum perspective. The first one is about what is called a first healthcare. We looked at the whole landscape, which I have been describing for the last 45 minutes, from the lens of a technology, 4IR technology or emerging technology, and see what can be done. So it's called Fourth Industrial Revolution, that is new technologies for sustainable transformation of healthcare. Is a nice little abbreviation, we made it. So in this is to achieve, the objective is to achieve better health outcomes. We surveyed the entire burden of disease and the problems, challenges, etc., through an expert group of doctors and administrators and providers as well, and created this concept. These are the kind of problems which I earlier mentioned in different contexts. I will not repeat. So how do we address those using emerging technologies? And this is the methodology we used during October 20 and March 22, and created this whole landscape of what can be done. So, end of the day, we identified 18 areas or prioritized these themes like cancer and immunization, health screening, awareness. These were by the experts, to expert analysis and based on statistics and disease of burden, which is very informative as such. The burden of disease statistics brought out by Lancet and IIPH, etc. After distilling, we identified 18 prioritized themes, and out of that, we again prioritized cancer to begin with for our intervention, and that's how we have gone to first cancer care as a case in point with the government of Meghalaya, where currently the project is going on. It's called Meghalaya Can Care. So why we chose Meghalaya government chose this framework, the first healthcare framework, was Meghalaya happens to have the largest incidence of cancer in the whole country. So that's how this is the kind of picture in cancer care. When we put our microscope on cancer, and then again with an expert group of about 30 topmost oncologists in the country, and the institutions related to that, we created this framework of what are the interventions that 30 interventions that can be helped digitally using emerging technologies. So the entire value chain, our patient journey is examined here, and we identified these 30 interventions for being tried out on the ground. So this framework was liked by government of Meghalaya, and they happen to be the highest incidence of cancer in India. So that program is going on at this point of time. And then the key objectives are to create awareness and mass screening. So the key to success in cancer management is to detect it early. See, most of the cancer cases that come to the hospital today, they go by the time they go to it is the third stage or fourth stage, where it is really absolutely difficult to stop further progression, and it's only palliative care that's possible at this point of time, and survival rate is pretty poor. So versus if you detect in stage 1 or pre-stage 1, right, even the prospects of getting into stage 1 at that stage, then it's 100% cure. So that is very eminently established in the cancer care field. So we are doing the awareness and mass screening of the population, then build the capacities not only for the doctors and specialists but also frontline workers, so that the screening is actually done in handheld devices by the frontline workers. And then also because as I mentioned repeatedly, data is fundamental to the whole thing. So we are also alongside creating an oncology data model. While we have health data models called HL7 and FIRE, etc., we are customizing that especially for oncology, working with CDAC. So oncology development model is almost ready for launch at this point of time. So that the entire cancer journey, which goes for 10 to 15 years in a patient's life, the record is kept as per as per standards. So that standard we are developing, it's not only national but also of global importance. So these 3 components we tried out in a pilot in East Khasi Hills, which again within Meghalaya, it is the highest is in East Khasi Hills. It has a population of about 800,000 people, and Apollo has been selected, Telehealth Network Foundation, but through an RFP process, and they are implementing the project. In fact, on 14th of December last year, I was in Shillong, and that was launched by the Honorable Chief Minister at that time. Even now, he's very passionate about cancer care, so that's how it's going well. And we identified 5 types of cancer for focus: breast, cervical, lung, oral, and esophageal cancers, which are more because of certain habits, be it smoking, be it tobacco chewing, being certain other habits, they are leading to more of these cancers in that area. So far in the last 5 to 6 months, when it really started picking up, about 25,000 out of a target of 3.2 lakhs. We have out of the total population is close to 10 lakhs, but the people from 30 to 60 who are more prone and they are in the risk zone, they are only being screened. That is the norm globally also. Screening is typically done in this age group. So for these 5 cancers, so out of that you can see a good percentage of that, almost less than 20%, about 16-17% have either moderate risk or high risk. So we are referring them alongside to the secondary and tertiary levels for the diagnosis, so that catch it early, then you can cure it with less expense, less pain to the patient, and survival rate is very high. So that's very much demonstrated in this project already, and so we are hoping that by July next year. Now we have increased the pace, having tested it initially, and in the screening, you can ask me, where are you using technology? So substantially we are using technology in the screening for these types of cancers. Especially we have very good AI-enabled thing for breast and lung. We are using that, and we are exploring for some more solutions, AI-based solutions for oral, esophageal and cervical. So this is what we are doing currently, using state-of-the-art technology for addressing one of the big human problems of cancer, and in a district and a state with the highest incidence. Once it succeeds, then we will have readily, it will expand to the whole of Meghalaya and the whole of the country. The National Digital Health Mission and the Ministry of Health is also part of this experiment. So we are hoping that we will be able to address cancer successfully in the years to come. So that's the future. How you leverage the power of that new technologies is the essence of what I'm saying. I stop here again, and any further round of questions I will welcome.
Hope you enjoyed this masterclass and thank you for watching. Don't forget to tune into our next one.